The Minister of Health, Dr. Amadou Lamine Samate, has said that more than 25% of Gambia's drugs are being consumed by neighbors across the borders. The minister made this disclosure before the National Assembly on Monday during the question and answer session. Fatmata Kasim reports.
The Gambia has one of the poorest medical systems in Africa, with shortage of drugs being a popular challenge in health facilities. This status do not, however, regulate our health system from serving heavily people from the sub-region. Concerned about the regular shortage of drugs in health facilities, the National Assembly member for Serekunda requested to know the reason behind the problem. Dr. Samate has the figures in drug consumption in response to the question by the parliamentarian.
I think from the starting point is, as a country, what is allocated for drugs is not enough to go the whole year round for our population. I think that's the starting point. So at the onset, the inadequacy is expected. But it's also very important for us to know that quite a big chunk of our drugs are consumed by our brothers and sisters from across the border. Most of the honorable members here who have constituencies around the border, they will attest to the fact that their facilities are inundated by people coming across the border because treatment is cheaper here and our people, our services tend to be better, and they are also closer to some of our facilities than their own facilities within their countries. So in fact, roughly what I'm being told is that above 25% of our drugs are consumed by our neighbors from across the border.
He hoped that the challenge in drug dispensation will be addressed when the ministry introduces the health insurance system. A monitoring team known as the National Pharmaceutical Service is at work to collect data as to what obtained on the ground of all health service provision centers.
So we have a monitoring team. A team goes around, the National Pharmaceutical Services, the Directorate, they have a team that goes around to see what is happening, and they also have a reporting mechanism. But we are discussing with partners, in fact our discussions are far advanced, in having an electronic system whereby as paracetamol, for example, stock dwindles in one region, at the central region they will know which facility is run out of paracetamol, and they will now prepare to supply, and they can manage the stock level real time. So that is going on, sir.
The minister added that patients at any of the facilities should not be asked to buy essential medicine prescribed for their treatment. The mission of the Ministry of Health is to contribute to socio-economic development and wealth creation by promoting and protecting health of the population through equitable provision of quality health care within the context of primary health care. The mission puts the concept of health beyond the confines of curative care of other socio-economic determinants of health. The health sector, despite remarkable achievement registered in the past few years, it is still under pressure due to a number of factors. For iAfrica News, I am Fatoumata Kasim.
More than 25% of drug in health facilities is dispensed for non-Gambian, according to the Gambia's health minister.